And breaking news from the Hill today, House Republicans had been banking on those blue dog Democrats, the conservatives, the moderates, to join them in stopping the health care overhaul. Now the blue dogs say they are in negotiations with Democratic leaders and are making progress, potentially paving the way for a Republican defeat. Just within the last hour, blue dogs and House leaders agreed not to vote on health care before the summer break. Congressman Mike Pence of Indiana, chairman of the House Republican Conference, joins us now. This may not be good news for you guys. It may be that the conservative Democrats and their leaders are coming together around something, and they will be able to outnumber you on the House floor.
Well, it may not be good news for the American people, Andrea. You know, House Republicans have supported health care reform that builds and strengthens our private health insurance system, but House Republicans and up to this point a handful of conservative Democrats and I think a majority of the American people oppose a government takeover of health care paid for with $1 trillion in tax increases. But, you know, you're right. We're hearing that the Energy and Commerce Committee is reconvening here on Capitol Hill today. There's rumors of a deal, but this is not a deal that's going to go over well with the American people. They understand what a government-run insurance plan will mean. Millions will lose their current health insurance, and many Americans will lose their job as a result of the higher taxes on businesses.
Well, this is what the president had to say today in rebutting what the Republicans, what you've been claiming. Let's listen.
Nobody is talking about some government takeover of health care. I'm tired of hearing that. Under the reform I've proposed, if you like your doctor, you keep your doctor. If you like your health care plan, you keep your health care plan. These folks need to stop scaring everybody.
Are you trying to scare people, Congressman Pence?
It's not us. It's a nonpartisan group called the Lewin Group, respected on both sides of the aisle, that said if the president gets his wish for a government-run insurance plan, 114 million Americans will lose their insurance. But they won't lose it, in fairness to the president, Andrea, they won't lose their current insurance at their job now because the government will tell them they have to give it up. They'll lose it because their employers, who are struggling to make ends meet during this difficult economy, will very likely say to their employees, look, if Uncle Sam is offering health insurance free down the street, we're no longer going to offer health insurance here at your place of employment. You know, the employers are going to say, look, we love you, but we got to keep the lights on and the doors open, so we're canceling your current health insurance. Most Americans understand that. For some reason, this administration doesn't understand that, and that's how a government-run insurance option that the president's insisted on is going to amount to a government takeover of our health care economy.
Despite all of this and your claims and the fact, as we are pointing out, that the president is having a lot of trouble and that his own poll numbers have been dropping in a number of polls and likely in our own that will be released at 6:30 tonight. But there is an NPR poll where respondents like the Democratic statement on solving health care problems a lot better than the Republican statement, 51 to 42. Are there some warning signs for you guys there?
Oh, look, you know, we've talked many times, Andrea, about the difficulty that Republicans have gotten themselves into with our own big government and reckless spending ways of the last 10 years. But really, I want to say, to the point of your earlier report, I don't think the problem here with the White House or with the Democrats in Congress is message. I think it's content. The American people are examining this massive expansion of the federal government's role in health care, the introduction of a government-run plan, $1 trillion in new taxes falling squarely on small businesses, and the content of this bill is what the American people are rejecting. What we ought to do is we ought to scrap this plan, and then we all ought to go home for August, listen to the American people, and bring forward truly a bipartisan bill this fall that'll lower the cost of health insurance and health care for every American based upon strengthening our private health insurance system.
Congressman, I got to tell you that there are plenty of people around coming from not only the CBO but elsewhere that would say it's not $1 trillion in new taxes, mostly falling on small business, that those claims could be debated. But it depends, of course, on which plan you're talking about. But I'm not sure of any plan that has $1 trillion in new taxes.
Well, I think the CBO number was about $800 billion, and you know, the reality is that...
But it wasn't all taxes. Those were costs, but not all taxes.
Well, the tax increases there, but remember, Medicare, when it was launched in 1965, was projected, I think, to cost $9 billion a year by 1990. It ended up costing 7 times that. So anyone who's looking in and thinks that launching a new government-run insurance plan, that we're going to be able to bend the cost curve, needs to look at the history of entitlements in this country to recognize we're increasing the burden on our grandchildren enormously if we create a government-run plan.
No debate on that, although I don't know that you want to go back to Indiana and campaign against Medicare.
Oh, no, I support Medicare and have supported the program. But the issue here is, how do we go forward in the 21st century? I think Republicans believe, I think most Americans believe, on the basis of strengthening our choices in private health insurance in this country, not a government-run plan paid for with higher taxes.
Okay, we have to leave it there, but thank you. As always, Mike Pence, good to see you.